It's saying 17 people so far, Stephen.
Okay.
Okay.
Maybe we'll give it. Maybe
another minute or so.
Yeah.
Yeah. For people to come in.
Good afternoon, everyone. Welcome to the South West London Cancer webinar. We will begin shortly. Please remain on mute and turn off your cameras. We have a fantastic host of speakers today to talk about cancer screening programme, and I'm going to begin by giving you an overview of the cancer screening programme. My name is Zayton and I'm a GP in Sutton. I'm the Macmillan GP in Sutton and supporting to chair this meeting today. Stephen, if we could move to the next slide. We also have Claire Berry, who's a Senior Delivery Manager for RM Partners Cancer Alliance, Maggie Luck, the Head of Young People and Adult Screening from NHS England and NHS Improvement London, and Zoraida Colorado, Programme Manager for Community Links, also speaking today. We also have some key members in the speaker audience who may support with answering questions, including Claire Bailey from the breast screening programme and Michelle Nichols, who will be supporting with the bowel screening as a health improvement specialist from the hub. I would urge you to kindly keep your cameras off and use the chat to ask questions, and put your hands up if you've got any questions as well. Thank you. Just wanted to review the cancer webinar programme, which is coming up in the next few weeks. We have a urology cancer survivorship programme coming up, skin cancer coming up on the 22nd of July, and haematological cancers coming up on the 28th of September, followed by thrombocytosis and vague clinical cancer symptoms. We would urge you to kindly book to those programmes, and you can click to book on the slides that will follow after this programme today. Next slide. So today's agenda is quite jam-packed. We've got lots of information and lots of things for you to take away to support you with your cancer screening initiatives in your local areas. I'm going to start by looking at the cancer screening programme and then hand over to Maggie Luck to specifically talk about the 3 screening programmes in a bit more detail. We will also talk about performance and variation across South West London, and this will be shared by Claire Barry. We will also then follow on to the Cancer Alliance funded projects which support primary care to carry out their initiatives locally. We will also be talking about the Mentors and Assessors GP Ask programme, and we will follow this by questions. So just moving on to the cancer screening programmes, we've just got a nice summary table here talking about the 3 national cancer screening programmes in England. You can see that we have the bowel screening programme, which includes the ages of 60 to 74 years every 2 years, but we now have an age extension being introduced very shortly, staged over the next 4 years, extending from 56 to 50-year-olds gradually. There is a letter that has been embedded in the slides that you can look through to understand how this age extension will carry through. But the important message is that the target is 60%. We are not very far off in our region, and we ought to support this programme so that we can try and achieve the targets and go beyond in order for us to support early cancer diagnosis in bowel. We also want to make you aware that the bowel scope screening has been decommissioned in December 2020. And this is now being followed through with the age extension with the bowel cancer screening programme through FIT. You will hear more about that. We have some information about how to ask patients to order fit test screening. I think the most important thing also to be aware of is that the fit test kits are different to your symptomatic fit test kits they use in practice. So for bowel screening, the patients get their fit tests through the post and should not get the fit tests through our surgeries, because that is for fit symptomatic testing. The next screening program is your breast screening program, which is offered to women between the ages of 50 to 71 years every 3 years. The target is 70%. There is some information about the breast screening helpline to support you through this, and also some information on the EBRL links shared there for you. Cervical screening program is a third national cancer screening program, which is carried out in practices with women ages from 25 to 64 years, offered every 3 years from the ages of 25 to 49, and every 5 years from 50 to 64. The target is 80%, and we are all working very hard in practices to aim and achieve this target, particularly in the younger cohort. There is initiatives, we will be sharing those initiatives with you to support you through your PCN DESs and QOF quality improvement programs. Next slide. So just wanted to really briefly mention the PCN DES that has been rolled over from 2020 to 21-22. And we're aware that we want to use the PCN DES to improve cancer referrals in practice, to increase the uptake of national screening programs. And the amended requirement is to work with our local system partners to agree a PCN contribution to the local improvement plans. So when you do your QOF quality improvement peer review meetings, consider having invitations from your local partners, from from Public Health, from Joe Cervical Screening Trust, from CRUK, and also for bowel screening through the health improvement specialist Michelle. I will just also add on here that Michelle gave a fantastic talk yesterday to the Sutton region about how to improve bowel screening specifically to the LD population. And she's very happy to do that across all the PCNs in South West London. So do use her as a resource, because she's got some fantastic information and slides to share. Also, the new requirement is to restore cervical screening programs by identifying opportunities across the network to provide cervical screening. So again, identifying specific groups and identifying and trying to make quality improvement to try and improve screening in those groups. And with the quality improvement and peer review meetings, to establish a community of practice to support the national screening program. I've added the national, the PCN DES as UBR links for you to have a look at in further detail, and very happy to take away any questions if you have any after this talk. Next slide. So QOF QI, which sort of complements the PCN DES, is really to focus on identifying areas of improvement of screening programs across the 3 national screening programs, and considering safety netting and referral processes with cancer specifically. With the screening program, it's important to, like last year, create an improvement plan with one of your screening programs, or all 3 possible, to consider where the inequitable uptakes are and how you can improve those uptakes with the initiatives that we're going to share with you today, implement a plan of action, and then review those again with the second peer review meeting. So we have some amazing pilots that we're going to share with you that the Cancer Alliance are developing within the PCNs, and we hope that you could consider taking those up to improve your national screening targets. So through those initiatives, you can use those for your peer review meetings twice a year in order for you to get your QOF points, but also support your PCN DES. Next slide. So just really quick, a few top tips for primary care. Just stay alert to people who've missed out on their screening appointments, because they may have done through the COVID period, either because they're anxious and afraid, or because of a delayed invitation. Consider those who've been delayed, but please reassure them that these screening programs are occurring now and encourage them to attend. Reschedule them for their cervical screenings for those people who couldn't attend the programs. and consider the inequalities and sort of consider having their assessments during the LD checks, for example, and using some initiatives that we're going to share with you later on. For those who were screened and received a positive result but did not attend further tests, for example, in bowel screening, again, try and safety net those patients, try and encourage them to attend their colonoscopies and advise them that all of these tests are done in COVID secure environments, and it is in their interest for them to attend. So I'm now going to move on to the next slide and share with you a whole host of useful resources that you can use to support you with your PCN-DES and quality improvement. There is Zoraida, who's talking later, Michelle, who is very happy to attend your PCNs to talk about bowel screening and the initiatives and improvement programs that she can share with you. And us in South West London, Stephen, please feel free to email us if you've got any questions or any worries about the PCN-DES and quality improvement initiatives that you will be undertaking. You've got Joe Cervical Trust, you've got CR UK representatives, so lots of information there to share with you, and hopefully you will use these resources and come back to us if you have any questions. And over to the next slide. So I'm going to hand over to Maggie Luck, because I know there's a packed programme today, just so she can talk about the specific national screening programmes and share with you some information. Thank you, Maggie.
Thank you. Good morning, everybody. I'm just going to give a quick overview of the recovery of the 3 screening programmes and let you know where we are at the moment. So if we could have the next slide, please. So looking first at cervical screening, we have to thank everybody in primary care for continuing to prioritise cervical screening alongside all of the other urgent issues that they've had to deal with over the last 15 months. We're now at a stage where we have screened more people since July last year than we did in the same time period in 2019. But as you can see from the slide, in May of this year, we did screen fewer than in May 2019. And we need to be careful that the numbers of women who are being screened does not drop lower. And we need to be working with all our partners to improve coverage and reduce inequalities in screening. If we could move on, please. So in our colposcopy services, all of them are now back to business as usual, although they're probably seeing 1 or 2 women fewer per clinic list than they did pre-COVID. We know that Epsom and St Helier are reporting that they have small backlogs of women in low-grade referrals, so that's both from direct referrals and from clinical non-urgent referrals, and that both Kingston and St Helier are missing out on the 6 weeks target for waiting times for low-grade referrals. One of the concerns at the moment is that 64% of referrals are made directly following a positive HPV result, and we need to do some work to understand the reasons for some of the non-urgent clinical referrals and to try and do something about reducing those. The laboratory is back to business as usual, and as you will all know, all cervical screening reports now come out of Cervical Screening London. We do know that the lab is receiving over 900 non-clinical samples every month, and these have to be returned to the general practice for onward transport back to the appropriate lab. This means that many of these samples will be non-viable and will have to be repeated, which is causing concern to patients and may possibly delay a diagnosis or delay a treatment. If we can move on, please. So on to breast screening. Now, this is the programme which is slowest to recover. We know that the programme was suspended between March and July last year, and then resumed with the most urgent cases being invited first. We've now moved to inviting women with open invitations, which means that they have to contact the London hub to book an appointment. And we were concerned that this would reduce uptake for the screening programme. We know that 50% of women who receive an open invitation will take up that invitation, which is lower than previously. However, we also know that 95% who do book an appointment will turn up to be screened. We, in South West London, have a backlog of 18,700 women who are still due to be screened. And we are hoping, well, the service is hoping that that will be cleared by March 2022. However, there is a shortage nationally of trained screening radiographers, and the service is working hard on its recruitment plan to be able to deliver the recovery. And if we could go on to the next graph, please. This shows you how the backlog has built up over time, and it starts when the programme was re-established in July. And at the height, we had 31,000 women in the backlog in South West London. And over time, as you can see, this has now dropped to the current 18,773 women. And we hope that this will continue in a downward direction to be cleared by March next year. We are working, as with cervical screening, with RMP and the ICS to ensure that the breast screening programme does fully recover and to support the unit and to reduce the waiting times for women in that backlog. If we can move on, please. So on to bowel screening. Again, this is another success story. The programme was suspended between March and July 2020. And by October last year, the South West London bowel screening programme was back to business as usual, which means that they had caught up on all delayed invitations and are now inviting men and women between -6 and +6 weeks after their due date, which is the national standard. The service is meeting all of its national standards and had continued throughout the second wave and possibly the third wave of COVID. And as has already been mentioned, they have begun to extend the younger age range down and started inviting 56-year-olds back in May. The aim is that we roll out to 50-year-olds over the next 4 years. And if we could look at the next slide, please. this shows you how the number of people who have been screened in South West London over the last 4 years. The orange line, or the yellow line, is 2020 to 2021. And as you can see, between September and December, we were screening a lot more individuals than we had done in previous years. And there is a small green line, which is 2021-22. And at the moment, we are slightly under the numbers screened on average in the last 3 years. The uptake, though, for bowel screening has improved, and it is currently 67%. The target is 60%. So well done, everybody who has been concerned in that improvement. Thank you.
So thank you, Maggie. Just picking up, if the next slide, please. Just picking up on some of the points that Maggie and Zeytin raised in their presentation. So just looking here at this data, so this, just want to emphasize, is 1920 performance data, and for the purposes of being able to illustrate the variance across the sector, there's a subjective RAG rating here, which is anything that's below 10% of the target I've coded as red. Anything that is within 10% of the target is amber, and anything above the target is green. So you can see here that there is a particular variance between younger and older women in the cervical screening. So with the exception of Sutton, all of the other 5 CCGs in Southwest London are at least 10%, sorry, in 1920, we're at least 10% below the national target of 70%. But for the older age group, we can see that most of the boroughs are, well, all of the boroughs are within 10%, and some of them quite close to achieving the target, particularly Croydon and Sutton. And obviously there's a difference in that younger women receive the screen every 3 years and older women receive the screen every 5 years. For bowel screening, again, just based on what Maggie is saying, we now know that we have achieved the target most recently right across the whole sector. But you can see here in 1920 that there was a variance. 3 of the CCGs or the boroughs were above 60% and 3 were below. And for breast screening, unfortunately, the data comes for the whole ICS rather than for at individual borough level, but we were quite close to achieving the target of 70%. I suspect, and Claire Bailey might be able to chip in at the question answer session at the end with an update on this, but the likelihood is that there are some boroughs that are very close to the 70% target now. What we do know, and I will raise this in a slide in a minute, is that there is variance within the boroughs as well. So this is not just between boroughs in Southwest London, but there's quite significant variance in performance at practice level and at PCN level. So the next slide, please. Thank you. So just thinking in terms of screening and inequalities, we know that there's quite a lot of evidence, and I don't want to overwhelm this presentation with all of the evidence, but there's quite a lot of evidence that suggests that in areas of social deprivation based on age, ethnicity, car ownership and country of birth can all participate in screening participation, and that those who are more deprived, who don't own a car, or Black or South Asian, they're much less likely to attend for screening, and younger women are less likely than older women to attend for cervical screening. So obviously with each of the individual practices and PCNs, you'll be familiar with the demographics of your area. If you know that your area has high levels of social deprivation, has high levels of Black and South Asian population, low levels of car ownership, or high levels of people that were born in other countries other than the UK, then the likelihood is that your screening performance is going to be quite low. Actually, can you just go back to the previous slide, Stephen? There was a link there that I just wanted to bring people's attention to. Thank you. So if you notice here, the link at the bottom of the screen will take you to your individual dashboard. So at practice and PCN level, you'll be able to see your performance. So just that this is quite easy to access. And obviously there will be information available to you as well in terms of your demographics and particularly around the indices of multiple deprivation. So going back to the next slide, Stephen, thank you. And then just to say that the South West London ICS team are currently developing a BI dashboard that will explore how to access information on cancer services and the outcomes, how they differ in relation to different populations. So that's not complete yet, but we expect that it will be complete in the coming months and that people will have access to that in terms of understanding more local data. The next two slides are just illustrations. So the NHSE breast screening recovery team developed a map. This is an interactive map. Unfortunately, couldn't get the tool to work on this slideshow. But if people want, we can circulate that map afterwards. But just these two slides illustrate how two wards side by side can have quite different performance that is related to the nature of their population. So if you can see here in Southfields North, so this is just a random selection of two wards in the Southwest London area where the screening uptake is 67%. This is for breast screening only, and they have low levels of deprivation. You can see that's 8.3, with 10 being the lowest level of deprivation. And the next slide is the neighbouring borough, or sorry, the neighbouring ward of. Can you, the next slide, please, Stephen? Thank you. Are you able to move to the next slide, Stephen, or whoever's managing the slides?
I'm on slide which shows West Hill North. Are you able to see it?
Southfields North is what I'm seeing on my screen at the moment. Okay, there we go. So that we can see that the neighbouring. We can see that the neighbouring ward has a screening uptake of 53%, but higher levels of deprivation. Now, you'll notice along the left-hand side of the screen here as well that there are a number of indices that you can click on. So you can see the population with BAME ethnicity, you can see countries of birth, you can see car availability. So I've just picked one variable here that, you know, is related to screening uptake. So I suppose what we would be encouraging practices and PCNs to be thinking about is what is your local population and how might that impact on your screening performance. So again, going back to the comments that Zeta made at the start of the presentation, the various resources that are available, both from what RMP, from Macmillan, from Cancer Research UK, from your screening centres, and from the ICS. There are a range of supports that are available to people in ensuring that the performance in your PCN or your practice approaches the target, and then hopefully in the very near future will start to achieve the target. So moving on then, Stephen, I think to the or I think we have the RMP funded initiatives coming up now. So just to inform people that RMP is funding a number of initiatives across Southwest London. The focus of these in relation to screening is improving screening uptake and coverage, but we're also very much focused on reducing variation and reducing health inequalities. As Maggie has pointed out in relation to the breast screening programme, we know that with moving to open invitations rather than timed invitations, there's a greater likelihood that women who are time poor, who are poor health literate, who don't speak English as first language, are less likely to ring up and make that appointment. We want to ensure that the screening improvement is a key element of our primary care education events, which we're currently commissioning and expect to be delivering from Q3 of this year. So screening will be one of the sessions in the education events. We'll be appointing a Southwest London screening clinical lead, and that person will be working with the PCN clinical directors to develop their improvement plans. And also we'll be commissioning a screening improvement facilitator, who will work with the screening lead, and that they will also work with the practice manager and staff to implement and review the action plans that are in place. The focus of the screening lead and of the screening improvement facilitator will be working with the lowest performing practices and PCNs. And we know that there's a large number of practices in Southwest London, so 1 or 2 people are not going to be able to work with all of those. So the focus will be on the practices with the poorest performance. Next slide, please, Stephen. Thank you. So just then in terms of cervical screening, so I'm going to talk down through the 3 screening programs and what the RMP offer is here. Over the last 18 months in Southwest London, RMP has been funding GP federations in each of the boroughs to deliver extended access screening. So that is where women can attend in the evening and weekends. There's been slightly different models in each of the boroughs. So some of those are delivered through the extended access hubs and the money channeled through the GP federations. In Wandsworth, there was a slightly different model in that the extended access was delivered by the practices, but administered by the GP Federation. So we're happy to have a range of models. It's whatever suits local needs. This is based. This project was based on an approach that was developed initially in Hammersmith and Fulham and has now been rolled out across the whole of West London. To aid with recovery, RMP funded all of those projects for an additional quarter. So that funding is due to lapse in the next week or thereabouts. And obviously, as Maggie has pointed out, the recovery of the deficit in screens was achieved in March of this year. Looking into the future, RMP undertook an expression of interest exercise with PCNs to understand if PCNs are interested in delivering extended hour screening, and quite a lot of PCNs in Southwest London have said that they are. So particularly in Merton, Wandsworth and Sutton, we will be moving to a PCN-led model. We have just signed off today with all of the clinical leads. They're happy with the allocations of funding. So we'll be going out to the PCNs who expressed interest to let them know what level of funding they will be receiving for the next 12 months. There's one slight administrative task that we have to attend to yet, and that's just understanding whether it'll be the GP federations or the ICSs who will hold that budget and make the money available to PCNs. But just to assure anybody who's on the call this afternoon, any PCN who expressed interest will get some funding. It might not be the total amount that they would have requested, but every PCN will receive some funding. We did allocate the funding across a number of metrics, which was based on weighted population basis, performance, and also people's capacity to deliver additional screens. So then moving on to our bowel screening project, and Zora is going to come in a moment from Community Links. So prior to COVID, RMP had procured a multilingual organisation, Community Links, to call patients who hadn't returned their FOBT kit or FIT kit as was implemented in 1920. Post-COVID, in discussion with the screening centres and the hub, we agreed that in order not to swamp the recovery that was ongoing, we would contact the Rising 60s, or the Community Links would contact the Rising 60s. That's people within 3 months of approaching their 60th birthday. And now with the age extension, the intention is that Community Links will expand that piece of work to include people who are in the Rising 50-60s age group. The approach is that we would make 3 attempts to contact patients who are due their kits, to explain the programme to them and the value of participating. IG has now been approved in all Southwest London boroughs, and Community Links are actively calling patients from all of the boroughs, not necessarily all of the practices just yet. And we are in discussion with the hub initially, and then obviously with the screening centre subsequently, with the view to commissioning a call reminder service for people who haven't responded. That won't necessarily take impact on the uptake, but our priority really from an Alliance point of view is to ensure early diagnosis of cancer. So while we might not influence the actual uptake or even the coverage stats, we would certainly hope that we will improve the early diagnosis standard. Zora, I'm going to hand over to you at this stage, maybe to update on the work of the bowel screening programme in Southwest London.
Thank you so much, Claire. So as Claire mentioned before, Community Links started running a reminder calling program in September last year to increase the uptake of bowel screening in those patients who are going to be invited for the first time. They are also known as the Rising 60s. The methodology of the program is that practices will run a quarterly template search, which will identify those patients that are due for an invitation in the next 3 months. Practices will send the data back to Community Links via the NHS.net account. And then our health facilitators who speak 20 different languages will contact the patients to raise awareness of the invitation and to encourage their participation. We also mentioned during our conversation that the kit is completely different to the one that family and friends received before, just an encouragement of participation in this life-saving screening program. Just some of the figures. So between October 2020 and May 2021, we have called 6,177 patients from all the different boroughs in Southwest London. We have managed to speak to 73% of these patients. We have an average practice participation of 78%, with Croydon being the lowest, with only half the practices taking part in the project, followed by Richmond with 68%. And I think we would like to take this opportunity for call for action to encourage more practices to sign in for the program. My contact details are within the presentation, and also the practice managers, they have received an invitation and several reminders from our team. So I will be able to tell you if your practice is already participating, and just to get you on board and start making calling your patients. That's it, Claire.
Thanks, Zora. I know that you're going to come back in a minute when we speak about the breast cancer screening program. So Stephen, if you can move to the next slide. Thank you. Again, going back and referring to what Maggie Luck had referred to earlier on, we know that the breast screening the breast cancer screening program of the 3 cancer screening programs has been the slowest to recover. That is a pan-London issue. That is not a specific Southwest London issue, though there is a particular risk in Southwest London to meeting the trajectory of March 22. Again, as we've referenced a number of times, there is a risk of increased inequalities due to the timed moving from time to open invitations. So on that basis, RMP had previously, again prior to COVID, had commissioned Community Links to undertake a reminder calls with a particular cohort of patients. Again, in discussion with the screening centre and the hub and the regional team, we agreed to repurpose those calls. And in Southwest London, we contacted, well, Zora will fill you in the exact detail of this, but we agreed that we would contact patients at the 14-day non-responder stage after they had received their open invitation. And again, in discussion with the screening centre in Southwest London, we focused on the sites that had traditionally had the lowest uptake, and when we knew there was a large population of people who did not speak English as their first language. Zora, will I hand over to you to speak about the impact of that programme, and then I can just reference what is planned for next year.
Thank you, Claire. So in terms of breast screening, Community Links has been contacting patients at 14 days of invitation from the areas of Croydon, Wandsworth and Kingston. Between January and June this year, we have contacted 10,680 patients. We managed to talk to 63% of these patients, and we book an appointment to an average of 46% of them. We found that an average of 8% of the patients that we talked to, they say that they haven't received the invitation letter, but we still go on to having a nice and open conversation with them and to encourage them to book an appointment with us. We have access to block appointments that are given to us by the screening service, and we receive the data directly from the breast screening administration hub. The screening service have run an audit for the calls that we have done since January, and 88% of the patients that we book for an appointment have now attended. Also, they mentioned that 33% of patients went on to booking their own appointment with the hub after talking to one of our health facilitators. The calls will now be done at 6 weeks after invitation instead of 14 days, meaning that more patients will have hopefully book an appointment by the time that we call them, and they will also have received their DNA letter. So basically our program will pass to be a reminder, original invitation program to be in a DNA reminder calling program. Again, we will still have access to appointments that we can give to the patients, and we will try to encourage as many as we can to go for this life-saving initiative. Thank you, Claire.
Zora, sorry, I seem to have dropped off the call. Can you hear me? Okay,
Yes,
sorry, I dropped off momentarily there. So just maybe just as a quick summary, the plan going forward. So apologies for that. I just had a momentary IT issue there. So the plans going forward in terms of the breast screening recovery programme is that we are continuing to fund the South West London Breast Screening Service. Some of the funding was allocated to additional admin posts for 12 months to support the team that are in place there, and there is also funding allocated for 16,000 patients to be contacted via call reminder service, be that Community Links or whomever. And again, the focus will be on contacting patients at the sites with traditionally the lowest uptake. But when we see the 88% of attendance by people booked by Community Links, I think that's a really positive outcome. So the final couple of slides from me, if you can, Stephen, go to the next slide. Thank you. I'm not going to talk down through each of these 3 slides in any great detail. I think the key take is I'm conscious that there's quite a lot of people on the call and they might have questions about all of the information that's been presented today by Zate and by Maggie Locke and by myself and Zora. So I think the key takeaways that we would want for people to take from today's session in terms of mentors and assessors for cervical screening sample taking is that NHSE had done a calculation that the regional deficit for sample takers is 206. In South West London, an additional 22 sample takers need to be trained, and that is based on the population and the number of samples that would be done over a period of time and what is considered to be a reasonable number of samples for each person to be for each sample taker to be taking. There are a set of criteria for eligibility to become a sample.
Sorry, Claire, you're breaking off. Perhaps switch off your camera may help.
Should I just continue?
Yes. Why don't we move up and we can come back to this? Maybe Claire can log on and log off.
No problem.
So I'll just go through the upcoming webinars for cancer survivorship, and we'll get Claire to come back to the mentorship shortly. Just aware of time. So there is a cancer survivorship webinar on the 1st of July, specifically on urology, talking about post-surgery incontinence, post-treatment, and post-radiotherapy complications. And we've got a really good host of speakers from the Royal Marsden and other areas talking about cancer survivorship and urology. Next slide. And you can see that the webinars for the urology, skin, hematological and thrombocytosis, which were shared at the beginning of the slide, are here. And please click on the link to book. You will also be able to review the recordings of these webinars if you're not able to attend them. Next slide. So just going to really sort of summarise the RMP South West London PCN DES cancer offer for 21-22. We've talked about the expression of interest for cervical screening via the PCNs. We've had some really good uptake on that, and the sign off for that is happening imminently. So PCN CDs and practice membership will be really pleased to know that there's funding supporting this work, and this will complement your QOF and PCN allocations to achieve your targets. We also have the bowel screening calling service by Community Links for the rising 60s, focusing on inequalities. Please continue to do your calling from practices. Natalie's commented on how do we know that we're not calling the same patients. I think it's difficult to know that, but I think if we can target patients through different mannerisms or different ways, we're more likely to get more uptake. Sometimes text messaging via pop-ups and AccuRx can help too. The breast screening program now is also being supported by Community Links by calling non-responders after 14 days. Following previous education successes, we're having further education webinars from Q3 onwards, as Claire mentioned. I'll go on to the next slide. I think Claire's back. I'll pass you over once I'm done this slide, Claire. The PCN network review meetings by establishing communities of practice, having invitations to the various partners such as CR UK, Michelle from the Bowel Screening Hub, as well as Claire from the Breast Screening Service to come and talk to you about and support you through these DES requirements, but also offer further support to your practices and practice members for further education and training. So please, I'd encourage you to do that. You've got your cancer leads there in the different areas to support you through the DES requirements. So clinical directors have access to that too. And of course, the primary care education, please sign up with Zara and her team for all the education events that are happening, which also have recorded webinars for support if you're not able to attend on the day. So I think I'm going to give the slide deck back to Claire, because I think she's managed to log back on and she can complete talking about the mentors and assessor sampling taking training. Over to you, Claire.
Thanks, Ed. I'm actually going to leave my video off just in case that is using up some of my bandwidth. So I think people have familiar enough with my face at this stage. So again, just outlining that there is a requirement around eligibility for who can become a sample taker. So it's outlined here. There's a registered nurse, a registered midwife, a registered physician associate, or a registered medical doctor. So essentially the ask to primary care in South West London, there are two asks. One is we want to understand for people to come forward to become sample takers, but in advance they will need to do a training programme, and that will be delivered by the London Cytology Training Centre. But in advance of that, we also need additional mentors and assessors. So there is a deficit right across London, and including in South West London, of qualified mentors and assessors. So if there are people who are sample takers already and have taken 50 cervical samples previously, they can undergo an online training program that will be delivered again with the support of the ICS and RMP, and that they will then go on to become either trainers in their own practice or assessors in a different practice. So obviously, if you're training somebody, you can't become their assessor, which is, I think, pretty much standard practice across everything. There are a number of links here on these three slides. So if anybody on this call, or if anybody in your practices is interested in either becoming a sample taker or becoming a mentor or assessor, please refer to the document here that's embedded in the slides that will be circulated, and also the links to the various training bodies. And Stephen is the primary link for this in South West London. I think that covers everything off in relation to the mentors and assessors as sample taker training. So that's it from me, Zed.
Are you there, Zed?
Yes, I am. I've just put something on the chat responding to Michelle's sort of message. She's got a fantastic set of slides for education for clinicians and non-clinicians, but also for specific groups such as learning disabilities. So please do contact her. She did a fantastic talk yesterday, as I mentioned before. And if you've got any further questions, we've got a few minutes before the end of the programme today. I would. Can all the speakers put their cameras on now so we can see your faces, because we've come to the end of our webinar well on time. So we've pulled through our information slides quite quickly. If there's any queries or concerns that you have, please do raise your hands, and we're very happy to answer and support any questions. Lovely. Michelle and Claire, if you could put your cameras on as well, because you're absolutely key in delivering this across Southwest London.
So I see Lisa has her hand up. Lisa, do you want to ask a question to somebody?
Hello. Thank you for that talk. That's really helpful. And it's nice to see that we're doing more for screening across Southwest London as well. Can I just ask a question to the panel, regarding screening in general practice? Can you give us sort of guide of how we can be improving screening in general practice, just for everybody to have some sort of guide in the background, because everybody's really busy. Screening kind of pops up on the corner there. Is there any sort of little nuggets that you could share with us?
So Lisa, we've so the resource slide that I showed, I think it was slide 5 or 6 that I showed at the beginning, has got lots of resources. I think you through your PCN DES and QoFQI, I think it's important to have an improvement plan for the 3 specific screening programs. You've got community links already calling non-responders at certain dates of non-responding, of them getting the letters. You can certainly use AccuRx to send patients information about the local hubs. So I think we've put some on the chat about breast screening locally to you, bowel screening, and obviously cervical screening through your own practices through the Extended Hours programme. You will be hearing more about PCN-led extended hours services to sort of target the non-responding cervical screening ladies, particularly young, particularly the time poor patients. So there's lots of information in the slide deck that you can take away, and of course the PCN offer from the Cancer Alliance for the different programs. So it's all there. Yes, do answer your pop-ups, do code your pop-ups to say that you have offered the information to the patients. And we're really fortunate now to have AccuRx, so we can quite easily support our conversations with text messages to patients. Has that answered your questions, Lisa?
Yes, it does. I mean, are there any? I don't know if there are sort of readily available sort of pre-worded texts about the screening services. With the options for the patient as to how they can contact. Are there any readily worded?
So you can pre-populate your AccuRx templates with your local breast screening numbers and bowel screening program numbers as well. So some practices have pre-populated AccuRx templates, and then you just have to send those across. Get your practice managers to have a conversation about those pre-populated AccuRx templates, and that should be able to. And I think someone's just mentioned that there is a bowel cancer screening text already pre-populated on AccuRx. So explore AccuRx, and if you don't have the local numbers, we've put some numbers on the chat. You can upload those onto AccuRx and pre-populate them yourself, or ask your practice manager to do this for you, and that should hopefully try and get you some headway.
And can I just add, I think the most useful thing that a practice can do is show that they support screening. So
Yeah.
whether that's putting posters up, having leaflets available, putting bits on your Facebook page if you have one, putting it on your web page, having easily recognized links to sites with information. Patients have an ongoing relationship with their GP practice where they don't necessarily with the screening services, and the more that you can do to show that you support screening, the more that permeates through the practice as a whole.
And absolutely, there's evidence showing that to support that. If there's endorsement from practices, then the screening goes up. And yes, so talk about screening when you have your medication review. Just remind patients, you know, sow the seed, as it were, and people will uptake more if you endorse it. So yeah, and you know, feel free to email us if you're having any trouble. And not only using your clinicians, but also your non-clinicians. So, some practices have also put the screening programs on their websites on a specific page for patients to explore in their own time. So again, you can direct patients to that as well. And you know, you got amazing people like Michelle and CI UK representatives, and you know, community links to support you to get those numbers up. We're doing really well in South West London. We want to do well. We want to continue to do well. Just keep up the good work and keep promoting screening in practices.
Thank you very much. Thank you. I mean, with our particular practice, you know, the inequalities that you've mentioned, you know, and you know, we have a lot of patients who do fall under those groups, and we also have a lot of patients who don't have access to the internet even. You know, or read text messages. So it's really important for us to do this. I think it's a very important service that we should keep up with. The trouble is sort of actually getting through to the patient, you know. Thank you.
So for those who are digitally disadvantaged, you can send physical letters to them. So you can, on the Good Practice Screening Guide, you can again download letters, or just pre-populate your own letters as per the AccuRx and send them through the post to the patients to say that you endorse it. And endorsement's already happening through MJOG and that. But you know, just the more you talk about it opportunistically, both reception, you know, non-clinical members and clinical membership in practices, that will help.
Yes, no, you're absolutely right. I mean, I've had a patient the other day who can't read or write. So I actually asked her to have an appointment with a social prescriber to actually help her book the appointments for her. So sometimes it needs to go, you know, that far to actually check why is a person not responding to screening, and it could be something as simple as they can't read or write.
Yes, absolutely. So I think that those are the inequalities we were talking about earlier, is really exploring those inequalities in your own population, but even the one-offs, just to support them. And there's so much information on gov.uk, like Michelle said, which I sifted through when you came to our practice the last time to look at, and there is tons of information on there as well, on language and easy read guides, but also, you know, things that you can download and send to the patient, you know, to support their you know, sort of disabilities or inequalities. So yes, thank you. So at 2 minutes before 1, I'm going to close our webinar. Thank you very much to all our speakers for the amazing work that you're doing and the amazing information you've shared, but more importantly to our South West London practices for all that you're doing to keep South West London up in the green zone, if I can call it that, and keep up the good work. And come back to us if there's any more resources you need, any more ideas you have. Very happy to support all of you to perform well as you have been doing so far. Thank you and goodbye and good afternoon. David, if we could stop recording.
Yep, no problem.
Thank you.
All right. Well done, guys. Catch you later.
Thank you, David.